Hi guys, this is a interesting case today, a very typical one, not so frequent encountered. So what do we see? We see a glenohumeral joint with important degenerations, huge cavities inside the bones. These are huge geodes with synovial lining inside, which is hypertrophied, and marginal erosions, hypertrophy of the synovium. And in subcoracoid recess, we can see a huge bag of lacunar images, which you can appreciate. These are calcified in the periphery, not so calcified inside, and they are like a bag of stones. If we go to different kind of sequence, this was PD fat set, and this one is gradient, T2 echo gradient, you can better appreciate and be more sure that this is calcification. So these are some loose bodies which are calcified in the periphery. You can appreciate that one of these loose bodies, or maybe more, are stuck on the bicipitolabral anchor, above the bicipitolabral anchor. And you see the bone is suffering because of these huge geodes. We also have some loose bodies in the axillary recess, and of course there is tendinopathy of the supraspinatus and erosions in this bare area at the junction between tendon, bone, and the cartilage, which ends around here. So this is a typical osteochondromatosis of the shoulder, and fortunately we have also the CT which confirms osteochondromatosis, because you see these calcified peripheric loose bodies inside the joint. We can confirm huge degeneration of the glenohumeral joint, and you can appreciate this is a bilateral condition, not so important on the right. There is other conditions. There is huge osteophytes in costovertebral joints, so maybe this patient has some sort of rheumatological disease. Unfortunately, I do not have many information on the clinical data, but what I wanted to show you is this typical aspect of osteochondromatosis. And basically osteochondromatosis osteochondromatosis is a benign condition where there is proliferation of the synovium, which produces some cartilaginous bodies like this, which sometimes fell off the synovium, and they become loose bodies. They are initially attached to the synovium, and then they will fall off into the joint. This is the primary osteochondromatosis, and there is a secondary osteochondromatosis where the process is a bit different, because first you have some osteocartilaginous bodies, loose bodies, bits of cartilage or bone in degenerative conditions, which becomes more calcified and enlarged over time. So keep in mind that this is not cancer. It rarely transforms into cancer, but unfortunately it's quite a serious problem, because this leads to joint destruction. Thank you for your attention. If you liked this case, please share, like, or subscribe. Thank you.